Today's topic is special sign and symptoms pertaining to surgery. What is sign? Sign is experienced by mainly surgeon. Symptoms experienced by mainly patient. In this we will discuss para-abdominal examination mainly with some surgical anatomy. In second part we will discuss external suspected clinical symptoms with some respiratory examination. Para-abdominal examination, we have to know about the borders. What are the borders of the abdomen? That is ASIS, anterior superior iliac spine, pubic symphysis, and these are the costal margin, and mid one is xiphoid process. These are the borders of the abdomen. Everyone know about the quadrants. I think 9 quadrants divided by the line, that is mid clavicular line. This one is subcostal line, and this one is transtubercular line. This area is epigastric. This one is umbilicus. This one is epigastric, hypogastric, umbilicus, right hypochondrium, and this one is right lumbar region. This one is right iliac region. Right left, right hypochondrium, left hypochondrium, right lumbar, left lumbar region, right iliac, left iliac region. Everyone know about the borders. After that quadrants. These are the some surgical anatomy only. Next one is during inspection, patient will be in supine position, and this point is xiphoid process. This one is pubic symphysis. First we will see the shape. Shape can be of scaphoid, normal or distended. If ruler put on the xiphoid and pubic symphysis, then abdomen be like this. This is scaphoid shape. If it touches the ruler, that is normal, and if it is outward the ruler, it is distended shape. We can easily see other inspected signs are scar mark. Any scar mark is there or not. Scar mark we will find what type of incision being taken during surgery. It can be McBurney's incision, Rutherford, Bickney incision. Okay. Other one is Coker's incision or LSCS, or any hernia occurs. In that can be inguinal hernia or umbilical hernia, or any laparotomy done, midline incision or right paramidline or left paramidline incision. Or other scar mark can be of subcostal, that can be taken for cholecystectomy. Second sign is tenual sign. In tenual sign mainly find out in the ascites, in which the distance between the xiphoid process and umbilicus will be increased as compared to the distance between umbilicus to pubic symphysis. This is present in the ascites. In ascites also, umbilicus shape will be smiley shape. What it will be? Smiley shape. Then in inspection we will see any tenual sign, any scaphoid normal or distended in ascites, or inspection done in the supine position. Other can be see the bluish discoloration that is found in pancreatitis. Hemorrhagic pancreatitis में क्या find out करेंगे? Bluish discoloration around umbilicus, then it is Cullen sign. Around the lumbar region, that is Gray Turner sign. If it is around inguinal region, that is Fox sign. This all we will find in the inspection. Then after that we will come on the palpation. Palpation में क्या देखेंगे? Palpation done in mainly in knee flex position, जिससे क्या होगा? Muscles will be relaxed, and when we can easily palpate the abdominal organ or any other sign and symptoms. These are the main sign and symptoms patient we can find out is referred pain, radiating pain, rigidity we know that is the involuntary action, and guarding is voluntary. Voluntary means patient is willing to spasm of the muscle spasm किसके कारण होगी, पेशेंट की विलिंग से, that is guarding. If whole over abdomen spasticity is present, that is involuntary action, that sign is called rigidity. These are some surgical anatomy. Everyone knows about the McBurney's point, that is medial to umbilicus is 2/3 and from ASIS anterior superior spine it is 1/3. This point is McBurney's point, and from umbilicus to this one mid inguinal ligament attached from the ASIS to which point? Pubic tubercle. That is the attachment of the inguinal ligament. If we will find out the mid-inguinal point, this is between the ASIS and the pubic symphysis. That is the mid-inguinal point. About 2.75 cm above क्या present रहेगा? Deep inguinal ring. And here it is present of superficial inguinal ring. These are the abdominal muscles, we know. This is the external oblique, this is the internal oblique, after that is transverse abdominalis. If there is defect in the external oblique muscle, that is near the pubic tubercle, that is superficial inguinal ring. And this is the deep one, defect in the fascia transversalis is deep ring. This will form the inguinal canal through which testes will descend. Okay. In intra-abdominal, in fetal life testis कहाँ बनती है? Abdomen में. After that testes will descend through the inguinal canal from deep inguinal ring to superficial inguinal ring. Then testes will carry same layers. External oblique will form. This is the layers of the scrotum. External oblique की continuation क्या होगी? External spermatic fascia. Internal oblique की continuation will be cremastic, and last one is transverse abdominalis. उसकी continuation क्या रहेगी? Internal spermatic fascia. These are layers of scrotum. ये I already explained about this. Deep inguinal ring, surgical anatomy का क्या होगी? These are the two triangles we should know. So first one is Hasselbeck triangle, second one is femoral triangle. Hasselbeck triangle boundaries will be inferior epigastric artery, lateral border of rectus abdominis muscles, and यहाँ third boundary will be inguinal. This is inguinal ligament attached from ASIS to pubic tubercle. This also inguinal is the continuation of which muscles? External oblique muscle. In femoral triangle, we will find out the femoral nerve, femoral artery, femoral vein. Then this empty space is called femoral canal. And medially we will what will present? Lymph nodes. And boundaries of femoral triangle will be sartorius. This is sartorius. This one is adductor longus, and this one is inguinal ligament. From femoral canal यहाँ से क्या निकलती है? Long saphenous vein. Here it is. In leg, superficial vessels will be long saphenous vein and this short saphenous vein. Deep vessels will be femoral vein and the popliteal vein. Here is the presence of saphenous opening from long saphenous vein. कहाँ किसकी ब्रांच है? femoral vein की. Now come to the upper abdomen examination. First we came to the stomach. Stomach can be peptic ulcer disease can be find out, that is of two type, duodenal ulcer or gastric ulcer. If gastric ulcer pain will be occur, that occur mainly in epigastric region. If it is something right side, that is duodenal ulcer, or hunger pain will be occur in duodenal ulcer. Referred pain mainly referred goes into the right shoulder, and gallbladder pain will be go to the right scapula or shoulder. यहाँ पे क्या प्रेजेंट होगा? डायफ्राम. Diaphragm is supplied by the phrenic nerve C3, C4, C5. If phrenic nerve irritated, then radiating pain occur at left shoulder or right shoulder. If here diaphragm irritated, then pain radiating to left shoulder. What is present here? Here is presence of spleen. In splenic rupture, that is Caher sign, radiating pain will be find out in left shoulder. Here it present of liver and gallbladder present at the gallbladder fossa. Then pain radiating to the right shoulder. Okay, this is the sign of the pancreatitis. You know about it. That is colon sign and great Turner sign. I already told about it. Other sign and symptoms you will find as fluid thrill or shifting dullness, as scratch test. This test performed in the hepatomegaly. What we will do? Stethoscope is put on the epigastric region and scratching start from the below. After that upward, there will be the change in the sound from here to here. This size should be 7 cm. Then it is normal. Then scratch test used for the hepatomegaly. If this distance is more than 7.7 to 7.5 cm, then hepatomegaly may be present. This is the scratch test. Then hook sign or hook technique used for the splenomegaly. And McBurney's tenderness mainly present in appendicitis. Appendicitis also have other sign and symptoms as rousing sign, Blumberg sign, Sauce sign, obturator sign. Rosy sign, it is shifting dullness. If you press the left iliac region, if we palpate or press the left iliac region, then pain will radiate to right iliac region because of bowel movement. In appendicitis, mainly pains present in the umbilicus region in starting. After that, it shifted to the Sharon's triangle. These are the conditions we will find out. In abdomen is hernia, and that can be umbilical hernia, inguinal hernia, femoral hernia. Other one is varicose vein. Varicose vein, many signs and symptoms will be present. Trendelenburg test. Other one is Pratt's modified Perthes, multiple tourniquet, Fagan test. In DVT we will have Homan test or Mose test. That is squeezing of calf muscles will generate pain in the squeezing cause calf muscles pain, that is present in DVT and not normally performed. Other condition are peritonitis. In peritonitis, that sign also present in the appendicitis. If peritoneum layer is inflamed, that is Blumberg sign. Last one is torsion. Torsion of testes will find the agonizing pain, that is intolerable pain. Other condition UTI, urine retention, or ureteric stone. Volvulus. The volvulus is twisting of the intestine. Interception is telescoping of the one part of the intestine into the other. Choledocholitis, vesicle stone, Fox sign, paralytic ileus. In these conditions, we will find pain, tenderness, tachycardia, pyrexia. These are the common things. Pain can be divided into colic pain, that can be continuous burning pain in peritonitis, perforation, PUD, and colic pain in that is gripping type pain. Find in biliary colic, ureteric, या फिर intestinal colic. Agonizing is already told intolerable pain in torsion or pancreatitis. Thrombing pain in hepatitis and cholecystitis. In abdominal aorta aneurysm, we will find the bruit, that during auscultation, and bowel sounds will be normal, abnormal in paralytic ileus and all. These already explain distension, pyrexia, tachycardia, tenderness. Last one is step ladder pattern में क्या होगी, peristalsis in small bowel obstruction. Thank you.